and proud of the work he's done. We're also joined today by Dr. Jose T. Montero, who comes to us from the Centers for Disease Control. Dr. Montero is the director of the Center of State, Tribal, Local, and Territorial Support, where he oversees support to the U.S. Health Department's and those serving tribal nations and other insular areas. Dr. Montero, we're honored that you've joined us, and we appreciate you for being with us today. Likewise, we are joined by Dr. Barbara Williams Skinner. Dr. Skinner is the co-founder of the Skinner Leadership Institute and the co-convener of the National African American Clergy Network of denomination and independent church leaders, and she has worked with pastors all around this country in a way that has been inspirational and effective. I cannot wait for you to hear her story. And last on our panel, a hero to all of us, Dr. Calvin O. Butts III, who is the pastor of the Abyssinian Baptist Church in New York City for over 30 years, and the president of the State University of New York at Old Westbury for more than 20 years. He has been on the front lines of COVID-19 and many other civil rights issues for a long time. You honor us with your presence, Dr. Butts, and we thank you for being here. Panel, let's get ready to talk for just a moment. There was an article that came out on March the 5th, 2021 in the New York Times, and the information it shared was sad, but unfortunately it was not necessarily surprising. This article informed us, if anybody wants to go and look it up, that African Americans and people of color had been impacted negatively and more disproportionately by COVID-19 coronavirus disease. No surprise there. But what the article said to us, which was surprising, was that in data collected by 38 states, here's the kicker, people of color, African Americans in particular, had been vaccinated at a rate of almost 50% less than white counterparts in the United States of America. It says to us that there is certainly room to grow and certainly work to do in providing vaccination and access to vaccine to African American people. I want to start with Dr. Montero. You are here from the CDC. If I could pitch to you first, would you tell me, please, what what is the CDC doing to help reach communities of color, and what information would you share with us about the latest vaccine rates in communities of color? Dr. Montero.
Thank you very much for the invitation and the opportunity to address the group here today. As we look at how we are working with communities of color, there are several different things that CDC has been doing. We do recognize that there have been many issues and the impact in communities of color, African American communities, have been disproportionate. They have suffered more, been impacted more, have higher mortality rates. So we are looking at how to, in vaccination, improve vaccination and make it that more equitable to other groups. For us, it's critical to increase access to COVID-19 vaccines in Black communities. And one thing certainly that we're trying to do is make the journey to vaccination as easy as possible. We work with the health departments and jurisdictions across the country. And we encourage them to increase vaccination points in communities. You can do that via mobile teams, hosting vaccination events at churches, YMCAs. In urban areas, we are encouraging jurisdictions to ensure that mass vaccination sites, pharmacies, clinics, hospitals, whatever mass vaccination sites we choose to have are accessible to people via public transportation. One of the actions that we have taken is requiring at least 10% of the funding received by each jurisdiction to be allocated to high-risk and underserved populations, which includes racial and ethnic minority populations and rural communities. Actually, out of $3 billion that were allocated for that, we are asking them to keep that 10%. In addition, we are going to be awarding early next month, the first week in June, $2.2 billion that are going to go to health departments specifically to address disparities in outreach and vaccination access. So we're going to be working again with health departments, and we're asking those health departments to partner and engage with community-based organizations. We have several specific different projects that we have programs. We have a program that's called REACH, Racial and Ethnic Approaches to Community Health. Through this one, we reach out to 20 national organizations that support community-based organizations and are going to help us improve the COVID-19 outreach. We have the Federal Retail Pharmacy Program that allows us to target disproportionate areas that are being impacted disproportionately by COVID-19. And then we have collaboration with community health centers and creating the community vaccination centers. So that is what we are doing. So sorry it takes this long. We are doing a lot of things to increase the outreach because we know that this is impacting the communities of color in a disproportionate manner.
Dr. Montero, we thank you and the CDC for your leadership in this particular area. One of the arms that the National Action Network, through the leadership of Reverend Sharpton, has always worked faithfully through has been the Black church. And I want to go to Dr. Calvin Butts next. Dr. Butts, of course, you are aware that there are some obstacles to vaccine access for people of color that tend to look like not having access to the internet, perhaps, to schedule online appointments for vaccine shots, or it could include not being able to have the flexibility in your work schedule to get to your vaccine shot. Or what about lack of access to the vaccine because of trust issues? Could you speak to us, Pastor Butts, about what the Black church can do to help close some of these vaccine obstacles so that people of color can get access to the vaccine if they choose to take it?
Thank you very much, and thank you for having me on this panel. The Black church is the first line, has been the first line of defense against any challenge to the life of our community. And certainly COVID-19 is such a challenge. I'm delighted to share in this conversation with Dr. Holmes and Dr. Bryant in terms of their leadership in our church community. People look to their pastors and they look to their churches. These men and women are trusted voices. So therefore, many in our churches, if Dr. Bryant would say this is the direction in which we're going, will follow him, believing that he is leading them in a way that will improve or protect their life, their health. The same with Dr. R.B. Holmes and others who may be a part of this. This was recognized early by a young woman named Deborah Frazier Howes when we first had to face the HIV/AIDS epidemic in our community. At that time, as now with COVID, we were disproportionately hit. And Deborah came to the churches and we organized across the country, across this nation, and we raised billions of dollars through legislation. We brought ministers together to address mistaken notions about AIDS, and we made a big difference in how our community responded. And while it's still a problem in many of our communities, it is nowhere near what it was. And now with COVID, Choose Healthy Life, based on Deuteronomy, has come forward using that same model, which is sustainable. And we've worked with Dr. Montero, Dr. Messonnier. We've worked with Dr. Fauci. We've worked with Dr. Frieden. We've worked with Lewis Sullivan, Dr. Sullivan. We've worked with Dr. Reed Tuckson and our pastors. We are now in 50 churches across these United States of America. We've received funding from organizations like Quest Diagnostic to actually empower health navigators in our churches. And if I can use our church as an example, and I'm sure the others have this, we are a vaccination site as well, and more importantly, or just as importantly, a testing site. Because even if we have received the vaccination, we need to get tested regularly to make sure that we are not passing the disease on to anyone. And so the church is extremely important. And as I mentioned, Choose Healthy Life, I salute Deborah in her leadership here, Deborah Frazier Howes, and she has made sure that we have a reliable fiscal conduit, and that's the United Way of New York City. We're working very closely with them to get the funds out to the various churches. And if we pinpoint areas, as David Jefferson in Newark, Reverend Dr. U.S. Senator Raphael Warnock in Atlanta. There's Reverend Dr. Frank Tucker in Washington, D.C. There's Reverend Dr. Horace Sheffield in New Destiny Christian Fellowship in Detroit, and Reverend Jacques DeGraff here in New York. All of us working together. And as a result of this, we will be reaching out to more churches. Now, key is that I share in the co-chairpersonship of this with Reverend Al Sharpton.
Yes.
And I'm pleased to call his name in this because we reach out through many organizations to many others, and our effort is growing rapidly. And with the connections in the government, with the connections through the churches, with the connections through other corporate organizations, we have made a major dent. This is what I know, I know this to my certain knowledge, at Abyssinian in the last several days, we vaccinated over 1,000 people. Mm-hmm. Finally, the medical schools, Meharry, Morehouse School of Medicine, Drew School of Medicine. I'm leaving out one that's very important. I don't know why it's not coming to me right away, but it's there. Howard University. These schools of medicine have said the vaccine is safe. These are our schools of medicine. These are our best, our doctors, our scientists. And so therefore we have to take our leadership positions and lead people toward improving our health. And this is a sustainable model. It went from HIV, AIDS to COVID-19, and we can take it even further. So I'm delighted to be on the panel. You have other experts like Dr. Barbara Williams Skinner, who has worked with our churches across many different areas. And I think this is the most impactful way of ensuring the best health for the Black and brown communities of our nation.
Dr. Butts, we thank you so much for your wisdom. We'll be coming back to you and looking forward to the comments from Dr. Barbara Williams Skinner in just a moment. Before we go to her, I want to talk to Dr. Jamal Harrison Bryant out of Atlanta, Georgia, who has, we've watched over the last several months, taken a creative approach that you saw birthed from what was happening around your church. We've watched you pair food distribution and COVID combat. Can you talk to us about what some of your thinking might have been in creating the novel approach to fighting this disease the way you've attacked it?
Yes, thank you. And let me thank Reverend Sharpton for his consistent, sterling leadership. And thank you for allowing me to think out loud with these amazing geniuses in praxis. Our approach has really been holistic. Because what the pandemic has done is it's pulled the sheets off of what has been taking place in the Black community. A few blocks from Dr. Butts, Malcolm X said, when white America catches a cold, Black America catches pneumonia. Well, we are in the walking flu. Reverend Saylor, since the pandemic started, we have given out groceries to 750,000 people. Every Saturday morning, some 600-700 people walk around the spans of our campus for 3 miles. We've been putting the doctors on duty, not just to do testing and vaccination, but regrettably and embarrassingly, a lot of our doctors, parishioners didn't have health care, didn't have access to doctors. And so we had a whole lot of work that we had to do. So what I saw, I'm pastoring now a multi-generational church I call Motown and Def Jam. So I've got people who are committed to Smokey Robinson and those who are committed to the Migos. The divide of my congregation is Motown lined up for the vaccination and Def Jam ran away from it.
Wow.
And so we had to have some real intentional dialogue and discussion because we got outside factors that hadn't really hit our community in large measure as it is now. holistic medicine, going to unconventional doctors and medical approaches. And so we had to have a series of dialogues and discussions, might I say, and debates about it. And it was not until they were able to see that it was a sister who was a Gen Xer, who was one of the lead contributors, that their ease began to come down. We have a right to have some level of paranoia when it comes to vaccinations, given our history. But we got to move through that level of trauma to get to a place of health and wholeness. And so it has not come without great battle and without great weight. We're coming eerily behind Abyssinia. We've done 1,000 in total, not for the week, but have been trying to do it incrementally. Our next one is next Saturday as a consequence. And according to our data, Reverend Saylor, 78% of those who have registered are over 55. Wow. So we've got a whole lot of work that we have to do for millennials and Gen Xers to get involved, but we're committed to it to try to move forward.
Dr. Bryant, I appreciate your leadership, and we look forward to your continued comments in the panel just shortly. Right now, family, I want to introduce you to another leader, prophetic in his leadership and great in his vision. Dr. R.B. Holmes from Tallahassee, Florida, has one of the most unique stories of being on the front line fighting COVID disparity of anyone I've been exposed to. Dr. Holmes, I'd like for you, please, to take a couple of moments and frame for those who are here in the auditorium, as well as those who are watching online, what you dealt with in terms of vaccine disparity in the Tallahassee community, and how you rallied together with pastors and churches to fight it to such a level that you received an invitation from the White House to commend you for your efforts.
Reverend Saylor, let me thank you for your effort, and let me thank President Sharpton for his vision to call us together. And I want to really thank my brothers, Dr. Bryan and Dr. Butts, and our CDC brothers for what they do. We know and we knew that when COVID-19 struck America, that Black people were gonna die disproportionately, and unfortunately, that has come true. And what we tried to do in the state of Florida, going back to what Dr. Butts said, we needed to talk about trusted voices. Who can our people trust? Who can get before our people and say, look, we have taken the vaccines. We believe that these vaccines work, as Dr. Bryant has said so eloquently. We know that sisters and brothers were part of this research. And as Dr. Butts said, our major HBCUs with medical school also signed off on these vaccines. So our job was, number one, to get trusted voices across Florida to say to our people that these vaccines are safe, we're dying disproportionately, and if we don't take these vaccines, we really will fall into what people want us to do, is to die. And so then the second thing we need to do was have trusted venues. Folk were not coming to Publix. They can't find Publix. They're not in their neighborhoods. We live in food deserts. So we had to really bring together trusted voices and trusted venues. And with doing that, we brought together some of our strong faith-based leaders across the state of Florida, the presidents of our HBCUs in the state of Florida, our elected officials, congressional leaders, the Black press. All those are trusted voices, and begin to put the pressure on the right people. So listen, we need to have pop-up clinics in the inner cities, the Black churches, place where people trust. So as we look at the data now, we're moving the needle, but still in the state of Florida, less than 10% of Black people have been vaccinated. Across this country, it's close to 8%. So our model is similar to everyone else's model. We got to get to where the people are. They don't trust a whole lot of folk, and the Black church has been the pillar. Now, unfortunately, I need to say this, I may get in trouble by saying this, but we fighting with pastors who are telling folk that wait on Jesus.
Wow.
You know, I mean, that we don't believe
Wow.
in these vaccines. It's anti-God. But with that kind of nonsense, I call it spiritual suicide and theological malpractice.
Wow.
What we're doing moving forward with the bad politics, with the bad policies, is saying that we have now over 121 sites across the state of Florida.
Amazing.
Ready to bring the vaccine in, with church leaders saying we will do this because this is about saving our people. We see this as a call, as a ministry. And I think that with what Reverend Sharpton is doing, what I'm hearing from my brothers here, together, we're going to win this war. And this is a war against this beast, this violent virus. And we believe that the vaccine work. Now we know what with J&J, what that means. There's always been a spirit of reluctance in the Black community. It is still there. But we have to overcome that because, again, our people are sick and our people are dying disproportionately. So these trusted voices and trusted venues will get us to, our goal is have 70% of African Americans and other people of color are vaccinated by the end of this year.
Reverend Holmes, your work is prophetic and heroic, and we honor you and thank you for your contribution. We'll be coming back to you in this panel shortly. Let me talk to the diamond in the group, Dr. Barbara Williams Skinner. I am honored to have you join us on the panel. Now, everybody watching this dialogue should know I was raised with the genteel values of a Southern man, and I was always taught ladies first. It had been my intention to start the dialogue with Dr. Barbara Williams Skinner first, but in conversating with her, the nature of her comments positioned her best at the end of the presenters, and you're going to see why right now. Dr. Williams Skinner, I thank you for honoring us with your presence today, and your leadership with the National African American Clergy Network has been phenomenal. Would you talk to the nation and to those who are here in the auditorium about what the National African American Clergy Network has done to close the disparity gap and to deal with this? Well, just let's talk about disparity first, please.
Right. Well, so thank you so much. And thank Reverend Sharpton for always being on the case. And of course, these prophetic pastors on the call, Dr. Bryan and Dr. Butts, my hero, and Dr. Holmes is my new best friend in this battle. And so good to meet our brother from the CDC, Dr. Montero. What we have is this. We don't have a supply problem. You know, 55% of Americans have gotten at least one vaccine of the two, but 65% of those are white, 11% are Hispanic, about 8% are Black, 5% Asian, and 1% Indigenous. We don't have a supply problem with the president saying you'll have enough supply from Moderna and Pfizer by late spring. We have a hesitancy problem still, particularly among the millennials, but we have a big vaccine equity problem. And what this COVID-19 has exposed is another systemic racism issue, like the census, like housing, like criminal justice. And what the Black church does is not wait for help. We don't call we don't say the Calvary is coming to rescue us. We are the Calvary. Mm-hmm. And so what I have is the honor of co-convening with Dr. Otis Moss Jr., a hero of so many of us, and Dr. T. DeWitt Smith, the African American Clergy Network of denomination and independent church leaders representing some 15 million members who've always shared information together, whether it's the census or voting rights or voter suppression. And so we've been able, since the COVID broke out, to say, what can we do? We're not going to wait for anybody. So we have, number one, we have partnered with Joshua Dubois, who worked with President Obama in the Ad Council, in a Get Vaccinated toolkit. And I don't know if you have that, but the toolkit involves really the basics that pastors need. Why should Black people be vaccinated? Trusted voices like those, like Dr. Moss and others, and Dr. Jamal Bryant and so many others, What are the benefits of being the steps for becoming a vaccine site? Pastors want to do this, and no matter how much the CDC talks about using other sites, the pharmacies or whatever, Dr. Holmes is right that it is a sacred place. Look, if you're already hesitant, you want to go where help is, and help is in the church. We have frequently asked questions from the Ad Council, scriptures on the value of human life, sample social media posts, key actions that faith leaders who are not sites can take, and all kinds of additional resources. We also have a 90-second video that churches are distributing all over the place. We got a small grant to Progressive National Baptist Convention for the Midwestern Regional to start educating pastors. Pastors need tools.
That's right.
In their preaching and teaching. So we've gotten that out. A small grant to the AME 11th District in Florida, working along with Reverend Holmes, Bishop A.J. Richardson, providing what? Stipends to those doing the parking ministry, voluntarily giving them stipends, those who are doing the cleanup ministry, the custodial ministry, stipends to those who are doing the intake and getting the assignments together. We got seed money to the Alabama Black Women's Roundtable and Black Ministers Group and Black nurses. What are they doing? They're registering older people who don't have access to computers and they can't register. So they're registering them. They're assisting churches that want to become vaccine sites. They're providing stipends and transportation for canvassers, just like we do when we're voting. They've gone out to canvass to neighborhoods that are just saying, we don't want this, to talk about why they should have it. And now they're obtaining 3 mobile units for mostly rural Alabama areas where there's no transportation. And then finally, we were working in Ohio with Dr. Otis Moss Jr. and the Mount Zion Oakwood Church in a Get Vaccinated site where the national sports arena, Cleveland Brown Arena, has been used. So the churches, instead of, while they're trying to become sites, they are actually busing people there in safe distance transportation to those sites. Out of that, they've done close to 5,000. They have gotten the toolkit to thousands. They are doing radio broadcasts, let people talk to a health care provider with questions. We have to let people ask their questions that we might call stupid, but they're questions that keep them from getting vaccinated. I don't care if they ask about, some people say that this is the devil's work. They need to be able to ask the question, if I got vaccinated, how long will that last? If I have lupus, can I do it? If I'm pregnant, can I do it? If I have heart disease or whatever, does this work? We need to give people the respect to be able to answer those questions. I'm also, through the National African American Clergy Network, working with an interfaith group of Muslim, Jewish, and Christian pastors, all trying to become the houses of worship, sharing information. And then finally, we're meeting on a regular basis with the White House, because here is the gap in equity. The disparity is about, if you're going to give $2.2 billion to help the local health and state health groups, and they have no incentive to use the sacred place of the church as a site, then you're not helping to close that gap. That's why you have 8% instead of closer to even our population, which is 13%. So those are some of the things that we are doing. I'm learning every day, listening to Calvin Butts and his group, and Dr. Deborah Frazier, following up on what Dr. Bryant is doing. And Dr. Holmes has taught me so much about how you bring trusted voices together. This is not an unwinnable war, like Calvin Butts said, with the HIV, but we have to be honest about where the gaps are. And the White House needs to be talked to. There needs to be some pressure. They're there because of us. Therefore, we need to be talking to them about where that distribution goes. Thank you so much for the opportunity.
Dr. William Skinner, your leadership is wise and effective, and we thank you so much for how you've led a coalition of pastors. We thank you so much for your contribution. Now, panel, I'm going to come back through the panel this time with a singular question for everyone. We've got about 10 minutes left in our talk time together. I could do this all afternoon, so I want to ask you to set your timer for about 2-minute responses, and this is the question you knew was coming. There is still a large degree of skepticism about this vaccine. You've all mentioned it. Can you give us your best approach to how we fight or combat skepticism, vaccine skepticism in the African American communities? I want to go in the order that I'm started in, so we'll start first with you, Dr. Montero. What can the CDC and others do to fight skepticism in communities of color, please?
So we know that people need to trust the vaccine, need to trust the vaccinator, need to trust the system that produced that vaccine. But at the end of the day, the messenger who tells them that counts above all of that. We need to identify the right messengers that have a trust relationship with our communities and engage with them in translating and addressing those questions, comments, and concerns from anybody in the community. That's why we have all of these different systems and contracts and partners that we are working with. I know that I have only like 30 seconds left. We have put a lot of money in national partners, different organizations that specifically target, address, and work with communities of color, brown communities. We have direct outreach. As an example, I did training of in Spanish of pastors of different denominations. I had a couple of thousands in different sessions where I went through many of these different questions. I got the question, isn't this the devil's work? And I answered it. So we need to be able to build that trust. And you are an incredibly important partner for us. In the African American communities, your work is the most trusted one. Help us help you keep your communities and our communities safe and healthy.
Thank you, Dr. Montero. Dr. Butts, the same question for you. How do we fight this skepticism? What's your best wisdom?
Well, I say that the pastors themselves need to be informed.
Amen.
And we need to continue to talk about this from our pulpits Sunday after Sunday. Take 1 minute for medicine, 1 minute for health, and tell people about the healing aspects. Now, a lot of our brothers and sisters don't go to church, but those who do have people who don't, and they can talk to them.
Wow.
I was fascinated by what Dr. Bryan had to say about the rhythm and blues generation as opposed to the hip hop generation and the divide there. But he seems to be making headway. And I'd like to take a look at that model. We need to share that. So I would say to pastors, look, get in touch with us at Choose Healthy Life. I would say call us at the United Way. I'm going to give a number now. It's 212-251-2500. That's 212-251-2500. That's the United Way. And ask for Choose Healthy Life. And let's begin to share what we've learned from our experiences. That's just fascinating listening to a divide in the congregation between what I would call old and young in one manner of speaking. But how is he being successful? Food is one way. We do a lot of food distribution. And so that's a way to overcome this skepticism. And of course, offering ourselves. I had to be one of the first to take the vaccine. Reverend Sharpton was right there. And I think we continue to press ahead like that. But we can't, with all that we put into our medical schools and doctors like Louis Sullivan and Wayne Riley out of downstate in Brooklyn and other places, we can't ignore into our younger men and women and our oldest. We have some old, stubborn people who just don't want to get it. We have to say, we have to trust those who have been trained and those who helped to create the vaccine. Oh, the sister Kizzmekia Corbett, Dr. Marcella Nunez Smith, deeply involved. These are important names. So I would just say keep talking about it from our pulpits, keep pressing, get as much information as you can, and make sure you give them a call, 212-251-2500. Choose healthy life.
Bless you, Pastor Butts. Thank you. Dr. Jamal Harrison Bryant, same question for you, sir. In 2 minutes, your parting wisdom. How do we attack this issue of skepticism?
The Bible has already given us the roadmap. It said clearly, our people die from a lack of knowledge.
Wow.
And so we've got to do education. I want to say a word to pastors who are listening, is that you will equip and empower your pew. That you will get a task force of health professionals who go to your church to open up those doors. I have absolutely no training that would put me in the room with Dr. Montero. I'm scared of needles, but I had to, in fact, equip those who were around me who had that knowledge. This is really the hour for the round table leadership, that we bring some doctors, some nurses, some specialists who can help us. Here at our church in Atlanta, we've done a COVID task force so that in our monthly newsletter, they give updates. What is happening in Georgia? What's happening in Atlanta? What's happening in the zip code of the church? How you can build your immune system? How it is that it has positively impacted the small number of adversarial impacts that have happened. We did 1,000 people. Only 3 people had migraine headaches after sitting out for those 15 minutes. So she'll give the praise reports. Do testimony service about COVID, about how other members of their family have survived and how you maintained and covered by social distancing, washing your hands, keeping your mask on. It sounds redundant, but Jesus often repeated in order to get the point put across. And so I would just dare say that we would keep championing the cause and raise up those who know it much better than we do.
Thank you for your leadership, Pastor Bryant. Dr. R.B. Holmes, same question for you, sir.
I just think that what we're trying to do with our statewide task force in the state of Florida is again, use trusted voices, the black media. Our people still listen to the black media. Our people still read black newspapers. We got to put the resources there. Our people still trust our HBCUs. That's why we have satellites on those campuses. I think that what Dr. Skinner was saying so beautifully, we got to put the resources where the people know the people. We've spent almost billions of dollars already talking about COVID-19, and less than 8% of black folk have been vaccinated with billions of dollars already spent. I think that Reverend, sometimes we're not talking to the right people. If I give Dr. Bryan or Dr. Butts or Dr. Skinner billions of dollars, I guarantee you they have everybody vaccinated, even the elephants and the monkeys. Because we know how to get the job done. And I think that what the White House is going to have to do, and we all support them, is to listen to other voices out there in the community that understand what's going on. I mentioned earlier, there's 127 satellites in the state of Florida, but we can't get the partnership with the right people to help those pastors get it done. Now, we also have set up grants throughout our city and county governments where they're giving out grants to local churches to get out there and beat the bushes to deal with the hesitation. So, but we got to do this differently. If we keep doing the same thing, the same way, it's insanity. Now, the same people that we giving these dollars to, prior to COVID-19, that brought about this healthcare disparities, and so we can't be doing the same thing. We got to look for those trusted voices in these communities and those trusted venues, and make sure we fund them appropriately where they can get the job done. At Bethel Church, we buying our own medical mobile unit, just to say we lead by example. And other churches want to do the same thing. May not have the resources, but the federal government have the resources to purchase those medical mobile units where they can go into these underserved communities and debunk some of that disinformation and misinformation and distrust and mistrust.
Pastor, thank you so much. Dr. Barbara Williams Skinner, the last 1 minute and 50 seconds belongs to you. Give us your wisdom. How do we do this?
allow people to state their fears, own them. There are legitimate reasons why they have them, but it's education that makes the difference. Use the radio, the black media, host a radio call-in with the health professionals there and allow people to ask whatever questions they have with the pastors supporting that. Put COVID vaccine and our press to get black people vaccinated in the larger healthcare disparity context. You're concerned about me getting vaccinated, but my high blood pressure, my fact, like I don't have health insurance. You're not concerned about my diabetes. So you've got to talk about it. The White House has got to talk about health, closing the health disparity, not just getting us vaccinated. And finally, I think the idea of getting the idea of most churches have health professionals. I love that idea. I think it was Dr. Butts. Use the people you already have. And finally, show images of pastors, trusted voices getting the vaccine, not just the political leaders, but the people who people trust getting the vaccine.
Thank you, Dr. Skinner. I want to thank all 5 of you for your service and your leadership on behalf of Reverend Sharpton and the entire National Action Network, many of whom are sitting here with me in New York and thousands who are watching you across the country. Thank you for being the vanguard on the wall and for fighting for vaccine equity for African American people. You've blessed us today. God bless you. We'll see you very soon. Thank you for what you do. Family, this concludes our time together.
You.
Bless you. And we are going to close this particular session. There are a couple of announcements from Reverend Toon. Thank you.